I wanted to be a doctor. And undergrad is your time for different interests, whether that's history or bioinformatics or anything. And I've always loved history, but I also love science. And so I decided to marry my two interests together and pursue a dual degree in bioinformatics and history. Even if you don't do two majors, take different classes in different areas. Explore your Renaissance human side. If you want to do pre-law, for example, you don't have to be a certain major or take certain classes. If for pre-med, you do have to take certain prereq classes, but you can major in whatever you want. Graduate programs love to see well-rounded applicants. Another thing is volunteering. Volunteering is so important to be involved in the community. And this picture is actually taken to a few members of our Alexandrian Society from way back when, working on cleaning up a local, I think it was a church or an actually it was an armory, it was an local armory. I think on Lee Street Armory. I think it's still there. And so it's so important to be involved in the community, whether it's working at a community garden, whether it's volunteering at a free clinic, or working at kids at Carver Elementary School. Graduate programs and employers love the quality of your experiences rather than the quantity of experiences that you have. For example, if you're involved in one volunteer and that same one activity, it looks better a few different ones, hour here, an hour there, and not really having a commitment. I was fortunate enough to be a volunteer at the Family Clinic while I was in undergrad, and I was there throughout med school, and now called the Health Brigade, I think. And while I was there, I was basically functioning as a nurse. I got to check patients in, or vital signs, work, and it was really an experience and really set the foundation for medicine. And don't forget to spend out of medicine or even your chosen field doing things that you enjoy, hobbies. For example, I was in the club field hockey team while I was at VCU. Here's our team. And of course, I did some running and part of the Alexandrian Society. And I was a Head Start volunteer at Tuckahoe Elementary School in Henrico County. And I got to work with children in the preschool, getting them ready to go to kindergarten. And all these experiences really helped shape my dedication to childcare and well-being. That's kind of carried me forward. Okay. The adventure that was med school. I was accepted to the VCU School of Medicine as a sophomore through the Honors College preferred applicant track.
Can you hear me?
Yeah.
Yeah, there's a bit of interruption from you, and I don't know if it's the headphones.
Can you hear me?
Yeah, I can hear you, but from time to time there's a little.
Uh-oh. Maybe let me take them out then. It comes out. Well, let me just take them out then. We don't need them. Can you hear me better now?
We can hear you, but let's see if that takes care of the interruptions.
Okay. We'll see if that helps. Okay, thank you. So I was accepted to the VCU School of Medicine as a sophomore through the preferred applicant tract in the Honors College. And this was a huge weight off my shoulder, knowing that I had been accepted to a medical school. Even so, I really had to work hard throughout undergrad to maintain my GPA, as well as to get a good score on the MCAT, which is the entrance exam for medical school. I entered the VCU School of Medicine in August of 2012. You're told that medical school is hard, but I don't think I realized how hard and difficult it would be. People say it's like drinking water from a fire hydrant with the amount of knowledge and things that they throw at you in the beginning. And actually, there's another picture of you have a different way of thinking and studying. So this is actually my notes on a whiteboard wall at the VCU Medical School. They built a new school, I think my second year of medical school, and it's got a state-of-the-art center with a great simulation center, as well as whiteboard walls. I love these whiteboard walls. I would just spend my whole weekend just writing things, kind of relearning all of my, studying from whatever I learned in class. I would just have it on the walls, and that's how we studied. And really, you have to change the way you study so many different times to kind of accommodate those different subjects. So the first 2 years are in the classroom. You're learning about the human body. You're learning about how it works. You're learning organ system by organ system. And then you're learning about how things can go wrong and what pathologies that they cause. And you really have to adapt and change that study style to learn that material. It's no longer about rote memorization. It's all about critical thinking and analysis. And then the last 2 years, let me see. The last 2 years are all about clinical rotation, which was the best part of medical school. we got to spend time in rotations at the hospital as well as outside of the hospital. I was so excited and lucky to be able to do doing my OB rotation at Inova Fairfax. And then I did a family medicine rotation in Stanley, Virginia. In Stanley, Virginia, which is next to Luray in the Blue Ridge Mountains, I got to stay at a horse farm that was covered by the program. And I also got to go on trips on the weekends. I went to Antietam Battlefield. I love history. So I went to Antietam Battlefield in Maryland. And I also got to go to Harper's Ferry in West Virginia. And that was awesome. But Stanley, Virginia, I think that was one of my most rewarding experiences, just being in a rural environment there. You can go all over the country, all over the world to do different rotations. And that's what's great about medical school. Like you can go do some classes in Europe or in Africa, you can go, or Asia, you can go do clinical rotations at different universities around the country. I got to go to UNC Chapel Hill to do a rotation, and then Emory University in Georgia to do a rotation. So a lot of fun there. Let me see. So medical mission trips. I got to go to Peru in the summer of 2013 to Pampas Grande, Peru. It's in the Andes Mountains as part of the Hombre trip. It's a humanitarian outreach medical brigade relief effort program. There I was able to apply my Spanish learning skills. And also you can do this program, you can go to the Dominican Republic and Honduras. But while I was there, really, it wasn't about helping other people. I learned more from these people than I think they took from me. They have a great healthcare system in Peru, but I got to work on my Spanish. I got to meet people from different backgrounds. We did some projects while we were there. You know, we had a greenhouse going. We checked people's levels, checked their anemia, because when you're at higher altitude, you have lower iron levels. And so we just got to do some research while we were there. And I just learned so much from my experiences with these people. And it was an amazing trip. And here's some pictures I took. This was our group. We had a pharmacist, we had a pharmacy student, we had some medical students and some residents actually who went with us. And it was just a great experience. And then I got to go to Machu Picchu, and, you know, the Final Four sure made it out to Machu Picchu. Okay. My path to advocacy actually started in medical school when I was involved in the Medical Society of Virginia student section, as well as the American Medical Association. I was able to participate in White Coats on Call for, I think, my 4 years of medical school. We would just, you know, once a year walk out to the General Assembly a few blocks from VCU and talk to our lawmakers about different areas that we wanted to, you know, advocate for in medicine, which was really great. I got to see how, you know, how we can advocate for our field. And now I do that myself here. Okay. After all of my experiences in different fields and clinical rotations, I decided to go into pediatrics. Richmond was all I had ever known, so I decided to leave Richmond for residency. I applied to different pediatric residencies all over the country, and after our interview season had concluded, I ranked my programs in order of, you know, preference, and I submitted that rank list to a computer, basically an application software. The programs I interviewed at also rank applicants, and they end up through this algorithm match the applicants with the programs. And so I actually matched at Medical University of South Carolina, categorical pediatrics track. And I was so lucky to have her. It was awesome. This was our match day where we found out what, you know, where we got accepted. We basically were handed an envelope. We opened the envelope at a certain time, and that kind of told us what our fate was, basically. So I matched at the Medical University of South Carolina, like I said, and I moved to Charleston in June of 2016. That became my new home for the next 3 years. Most programs, residency programs, internal medicine, I think psychiatry, family medicine, OB are like 3 years, 3 to 4 years. Some are 5 years. I think general surgery is a 5-year residency, but pediatrics is 3 years. Residency is the final step of training to become a physician. It's not really what you see in like Grey's Anatomy and The Resident, like those TV shows. But what we do is we take care of patients in the hospital, and we see patients in our clinics, and we learn. Pediatrics and medicine in general is all about lifelong learning. And this is my residency class. There were about 19 of us, and every program has a different number of people. Ours was a mid-sized program, and so there are larger programs that have like 40 residents a year. Ours was about 20. So each year is divided up into inpatient and outpatient rotations. Our inpatient rotations are general wards, so we're in the hospital, we're in the emergency department, we're in the newborn nursery, we're doing the intensive care units, so the pediatric or the neonatal intensive care units. Outpatient is primary care. We have our own clinic with our own patients that we start seeing from the first day in residency, and we follow them for our 3 years in residency. And we serve the Charleston community. We serve the inner city community. And most residency programs are in the major cities, and they serve that inner city community. Also, we did electives in cardiology, we did electives in like gastroenterology, endocrine, rheumatology, like anything you can think of. You do different electives in different spots to see what you like, what are you interested in. And while in residency, I was very fortunate. I got to go to a few conferences across the country. And this was, I think, in Baltimore last or 2 years ago now. And I got to present my research. My main research topic while I was in residency was about obesity and the comorbidities related to obesity, like high blood pressure, diabetes, and high cholesterol in the blood. As a resident, I was very involved in advocacy from the very beginning as the American Academy of Pediatrics representative for my class. I had the opportunity to go to some more conferences in both South Carolina as well as in the country, around the country. Got to go to Orlando 1 year, which was awesome. And I've been also fortunate to be an advocate for children at the South Carolina State House. This was, I think, 2 years ago, got to go to the State House to advocate for children. And this was, I think, the year prior. It's a beautiful building, and we got to speak with our lawmakers, our senators, our House of Representative. And it was just, great to see them and talk to them. And they really respond to you when you have your white coat. They were like, oh, that person knows something. So let me listen to them. So which is really, really awesome, because we got to do what we can for kids. My experiences during my 3 years of residency culminated in my decision to go into primary care. Initially, I wanted to be an infectious disease specialist, and then I changed my mind because I loved cancer immunology, and I wanted to be a hematologist oncologist. However, I think I decided through residency I was more interested in overall advocacy, overall preventative care, and establishing a strong relationship with my patients and their families. I take care of the whole family unit. I don't just take care of the child. So I married my husband in the summer before my 3rd year of residency, and his family's actually from Charlotte, which is why I came over to this area. Rock Hill is a suburb of Charlotte on the South Carolina side. I interviewed at so many places, but in the end, Rock Hill Pediatrics was the place for me. So it's a large practice. There's about 20 providers amongst 2 locations, and we're thinking about opening up a 3rd in the next year. I see a wide variety of patients from different socioeconomic classes. I've only been here a year so far, but I already have patients I've been following since birth, which, they're a year old, but it's still awesome to have families who really put their trust and faith in you to take care of their children. In October, is it coming up? Oh. Sorry, guys. Okay. In October 2019, I became board certified. I had to sit for my board exam in pediatrics to become a certified physician. And then I found a few months later that I had passed, which was great. And so that's what those 4 letters at the end of my my title. So it's FAAP, Fellow of the American Academy of Pediatrics, which is great to be part of that. Well, what do pediatricians do? I know you probably remember going to see yours when you were growing up. Well, we take care of the whole patient and the family. Like I said before, we see patients birth to age 21. We do annual well checks, vaccinations. We do sports physicals, sick visits, mental health checks, ADHD, just a little bit of everything. And I really feel that a pediatrician is a unique physician. We're not just doctors. We are also social workers. We are nurses. We are also mental health workers. Especially with COVID, we've seen a humongous increase in children with, anxiety and depression from having to stay at home and not being able to go out and see their friends and be at school. And so we help, manage that, and we help kids kind of transition. And I can tell you, it's the most rewarding experience of my life. I love what I do. I'm very happy. you know, being a doctor isn't enough for me. I have to do more things. So I am actually the site coordinator for the Quality Through Technology and Innovation in Pediatrics, or known as QTIP. QTIP is awesome, and this is through the Department of Health in South Carolina, and it's a bunch of different practices that kind of work together in different areas with the goal of improving care through quality improvement projects. We've done things with asthma, so setting up asthma action plans, increasing screening rates for asthma, as well as continue to manage control of asthma, also depression screens, making sure we're universally screening our patients, because this is a benefit to our patients. We're doing things that benefit our patients. We're improving care. Breastfeeding medicine, want to make, help our families, encourage them to breastfeed, because breast is best. And if we can encourage them to breastfeed, that's the healthiest thing that they can do for their child. Also, oh, and this is, we do an annual pumpkin decorating, and this was my and my nurse's pumpkin this year. We both love Starbucks and donuts, so that was one of ours. I'm also the South Carolina American Academy of Pediatrics Immunization Liaison to the Department of Health in South Carolina. So I basically work with the South Carolina AAP as well as DHEC, which is our Department of Health, with their immunization group to kind of see where are we, losing ground in vaccines, especially with the pandemic. We've actually had a lot of kids not come in for their vaccine visits. And so we're actually down like 50% in regards to vaccine rates because of the lack of follow-up, because people are scared to come into the clinic, understandably speaking, fear of COVID and contracting it being in a high-risk place like a doctor's office. So I help, work on things with the DHEC, with the Department of Health, and I take that back to the American Academy of Pediatrics. How can we improve our vaccine rates? How can we get patients back into the clinic? And so I'm a liaison for that. And I'm currently working towards my IBCLC certification. Well, what's IBCLC? Well, it's an International Board Certified Lactation Consultant. A lactation consultant is someone who works with new moms and helps them to learn how to breastfeed. Breastfeeding is supposed to be innate, but many of the times it's not, actually. It takes a lot of work, and I think through my own journey of breastfeeding with my new baby this year, I have a newfound respect for all moms. It's so hard to do, so I want to help my patients, and I think as a physician, as a pediatrician, I am in the right place to help my patients, and my goal is to create a breastfeeding center at my practice to help my new moms kind of get through breastfeeding and just support them along the way. So that's what I'm working on currently. It takes about 90 hours of learning, and I'm only 5 hours in. So we're going to get there soon. Okay, so advocacy. I've talked about advocacy so much because this is something that's near and dear to my heart. And this is actually one of the motivating factors which has guided me to a career in primary care. I'm a tweetieatrician. What does that mean? Well, I'm on Twitter all the time. And I tweet things related to cigarettes, related to voting, related to, gun violence prevention. And I'm going to talk a little bit about some of that in a little bit. This is a picture that I took with Mona Hanna Atisha at a conference 2 years ago. She is the pediatrician in Flint, Michigan, who was basically the whistleblower who found the high lead in the water. She was noticing it in the levels, the blood levels of the patients in her clinic. And she wrote this book, What Eyes Don't See. And it's all about kind of her path to how she was able to kind of alert the authorities. This is going on and we have to do something about it. It can take one person to make a difference. And she really exemplified that. Another big thing is with kids, like kids don't have a voice. Also, kids in, lower socioeconomic backgrounds and poor backgrounds, they don't have the same access to healthcare that a lot of people do. They're also more sick than people in higher socioeconomic classes. And why is that? Why are there so many health inequities and health disparities that exist in our country? And I feel like she highlights a lot of that in her book. She's just truly an inspiration. And so I got to meet her while I was there, and she signed my book. But I want to be a pediatrician. I want to be somebody who advocates for my patients more. And it's not just in the clinic, it's outside of the clinic. I also do some TikTok videos. There is a new thing on TikTok where you have medical providers, mental health providers, lactation consultants who put videos on TikTok to help kind of spread awareness and get to those people who are using those platforms, the social media platforms. I wanted to share 2 of them with you. Hopefully this will work. I think I have to unmute from here. Is there an echo? Okay, can you hear this, Bridget? Okay, let me see. I don't think that's gonna work actually. I got too much background noise. Can you hear me now?
Yep.
Okay, perfect. So I have this one video about coming and get your vaccines, about, we have a program called Reach Out and Read, which we give books to children age birth to 5, because reading is not important, not for just for them to, know words. It's for them to kind of bond with the family, to hear words and things like that. Let me see. And then I have another one about acne. Maybe if you can maybe share my presentation, I can send it to you, or you guys can look me up on TikTok. I think it's Dr. Ranya Chakra. And I've got a few ones about like acne, getting in for your well visit, about breastfeeding. So that's a really good area.
Do you think you can type that in the chat?
Oh yes,
yeah,
I definitely will. Before I hang up, I will put that up in there.
Okay.
Also, I like the with regard to advocacy, before it escapes me.
Yes.
Could you say something about the voting? What do you do under the form?
I'm gonna get there. That's my last.
Okay, all right.
I got you. That's super important too. Vaping that's become my child. After I went to a conference in my 2nd year of residency, I found out about Juul and how e-cigarettes were invading high schools and middle schools. And so I got really interested in that. That's been a major area of focus for me. And I recently actually spoke with a joint group of lawmakers and private citizens in South Carolina. And I'll talk about that in a second, but it's just really been a major focus for me. 99% of adult smokers start smoking before the age of 25, with 95% being before 18 years of age. And vaping is smoking. A lot of people think, oh, I'm vaping, I'm not smoking. Oh, it's the same thing. You're still inhaling these horrible, harmful particles into your lungs. Now they have so much delicious flavors. So, it's a kids menu and kids are getting addicted. The latest National Youth Tobacco Survey from 2020 showed about 3.6 million United States youth are using e-cigarettes. 20% of high school students are using them, 5% of middle school. 5% of middle school students are smoking. That is insane. And I recently spoke to, a group of lawmakers about urging them to support a statewide retail license for all tobacco products, including e-cigarettes, and to raise the prices of these products to help put them out of the reach of adolescents. So that's something that's super important to me. And then Be Smart is or an interest of mine as well. It's about gun violence and gun safety. So we actually partnered with the Rock Hill Police Department, got some gun locks that we could bring into the clinic. And when I ask a parent, is there an unsecured gun at home? And they tell me yes. I said, here's a gun lock, please lock it up. But Be Smart is a great program. It stands for, there's an acronym with it. So SMART, S is secure, secure all guns in the home, model responsible behavior around gun use, ask about the presence of unsecured guns in the home, recognize the role of guns in suicide, and tell your peers to be smart. And here are some other posters with some stats on it. 41% of adolescents in gun-owning households report having easy access to the guns in their home. 17% of high school students have seriously considered attempting suicide within the last year, and guns are a leading cause. Having a gun at home, it's like an easy way for a child to unfortunately commit suicide. So locking those up, securing those guns is super important. And I talked to my parents about that. And now, #VoteKids. So a kid cannot vote. However, I tell my families, I want you to go and vote so that you can advocate for your child. You are the person who knows your child best and who wants what's best for your child. And how do you get that out? You use your voice to, keep your child's health front and center. Dr. Moore, was there anything else that you wanted me to talk about in regards to voting?
No, I thought I just wanted to know how do you do it? But so I guess you don't, it's not prescriptive, it's just informing them that they just telling them about their rights then.
Correct. Well, and actually, so there's a program from an ER physician. I'm not sure where he is, but he made this big organization called Vote ER or Voter, and I have a lanyard from them, and as well as a little like a card with a, I don't know what they call them. Those things that you put your phone up to, the codes, and you can scan it and it takes you to a website. So you scan your phone on this code and it takes you to a voter registration website. And so I've been in my rooms with my patients. I'll show them this card and be like, are you registered to vote? If not, here you go. Here's a QR code. It's QR code. That's what it is. A QR code. And I also have these like sheets of papers in my room where I hand them to parents and say, if you haven't voted, or if you haven't voted or you haven't registered to vote, go do that. And that was before the deadlines passed. But now I do tell them, please go and vote. That's the best thing you can do for your child. And along those lines, also get your flu shot. Hopefully everybody's here is getting their flu shot this year.
Okay.
Fun year.
All right, that's great. As you may know, well, you would know, of course, that the whole business of voting is more important now than ever because it's tied to health and healthcare.
Yes.
So I hope people understand that. And just today, some of the states are throwing cases out of court. They're not going to count all the votes. So Trump is bragging about that victory that he had. I think it comes from, I'm not sure if it's Wisconsin, but so it's actually too late now to even vote by mail because if the votes are not going to be, a lot of the votes are not going to be counted. So maybe, when you educate parents, I hope, that people will know that their votes may not be counted right now it looks like it's going to be better for people to take whatever health risks they have with caution.
Yep.
Going in person because a lot of votes are not going to be, this is a country that prides itself on democracy and they're not going to count the votes.
And it's interesting you say that. So South Carolina, we don't vote early, we vote absentee to vote early. And my worry is that some of those absentee votes will not be counted. So I'm waiting until Tuesday and I'm going to go in on Tuesday. And I have a bunch of colleagues who have already voted and family members who have already voted, but I'm saying I'm going on Tuesday. I'm going to vote Tuesday in person. I'm going to be there at 6 a.m. The polls open at 7. I'm ready.
Yeah.
But yeah, no, that's something that's really important to us. And this kind of goes along with the whole thing that, being a pediatrician is not just about health, it's about everything. The social issues are issues that are impacting our children. Children take mental health, like depression, anxiety, and they manifest these, mental health disorders in physical ways. And so a kid comes in for abdominal pain or stomach pain. Well, is it really stomach pain? Or are they really anxious or nervous about something? Are they really sad about something really bothering them mentally? That's something that's different between children and adults. Children are not little adults. They are their own person and have a completely different physiology from adults. And so making sure you take that into account. You go into that social history. That social history is so important to take care of kids and young adults. But yeah, we're definitely seeing a lot more mental health. That's a lot of what we do.
Do you have Black patients?
I do. So in residency, the majority of our patients were African American because residency programs usually manage, or we see those poor families in the inner city, and we're about half and half Medicaid and private insurance at my practice. But I see a little bit of everybody. Yeah, but we do what we can to help. And we do what we can. And I think that kind of brings me to like work-life balance and the importance of work-life balance. You want to make sure that you're getting out with your family. This is my husband and my baby. We went out to Sunflower Fields a few weeks ago. I am lucky that I only have to work 4 days a week and 1 weekend a month where I work Saturday and Sunday in the morning till about 1 p.m. So I'm very lucky in my calls. Like when I'm on call, it's basically what we call mommy calls. So parent calls to ask advice about, oh, my child has a fever, what do I do? And so, I'm so lucky that I don't have to go into the hospital. I don't have to see patients in the hospital anymore. I can leave my work at work for the most part. Though Dr. Morty, if you remember, I'm a dedicated person. So I do check my
I know,
messages.
you
I
bet
check
I
my
know.
messages at home. I'm not gonna lie. I do call parents from home sometimes, but I am able to leave work at work if I have to. But I do cherish my time outside of work to spend with my family.
Yeah.
My parents are still up in Richmond and they're always coming down. My sister's actually here right now and she's upstairs with the baby, so he's crying. So she's helping me take care of him while my husband's at work today. But it's awesome. It's been great.
But your husband has a big smile on his face.
Oh, he loves his baby boy. He loves. Yeah, he was very excited when we said we were going to have a boy. So we found out. He was very excited. Yeah, and we love this kid. He's like the cutest thing. And he was 9 months yesterday. His 9-month birthday. So I can't believe this first year is almost done. So it's been a wild ride. I think this is my last slide. So I really want to, foster a discussion. If you guys have questions, I want to answer them. I guess I can also put in the comments my email, so you can email me afterwards if you have any questions too. Let me see. Here's a chat. But yeah, what kind of questions do people have? Any comments?
Well, let me just start with one, and then others. I hope others will have questions. But as you said, I've known you mostly through the Alexandrian Society, and I kept telling people how you all used to be there at 8 a.m. The room was usually packed at 8 in the mornings, and it's become increasingly difficult for me to engage students. It's just hard. Just hard sometimes. Dedication might not be there. They just seem not to have the drive to do certain things. And as you've made clear in your presentation, that employers, schools, whoever, the people who are looking at applications don't just look at the grades. As you said, they want well-rounded people, and the letter of recommendations, hopefully people, depending on what people write, can give an indication for those things. But let me just ask you, what has driven you all these years? Is it something that runs through? Is it partly cultural? What it is that has kept you driven so much all these years?
I think you hit the nail on the head there. I think cultural is a big reason. My parents were always instilling in my sister and I, like, the importance of doing well in school and concentrating on our schoolwork. And that motivated me in the beginning. And I think it kind of laid a foundation for me to kind of seek out opportunities wherever they were. I think it's just really important to, you enjoy your undergraduate years, but also work really hard because, as we've said, you need to have a variety of experiences so that your employers know that you're a Renaissance human. You have lots of different interests and you're able to work under different stresses and scenarios. You just have different experiences. I mean, different experiences is kind of like your foundation there. But I think using your time in undergrad to explore your interest and decide what you want to do. And then when you do decide, don't forget the other stuff that you enjoy doing, but also, find areas of interest in that field to kind of motivate you to keep going. Because you won't be motivated to do well if you don't enjoy what you're doing. So you want to make sure you do that. You have to find your niche. And I think I found my niche. That's why I enjoy doing what I'm doing, because my husband's very busy. He's a pharmacist and he's so busy at his work. And he doesn't enjoy it as much as I enjoy my work. I can tell you that. I love seeing kids. I walk into a room of kids and they're all smiling, unless they're getting shots, and then they're not smiling. But they just make going to work so fun.
I just want to say hi, Ranya. It's Kathleen.
Hi.
Hi. I don't have the camera on this computer, but anyway, I'm here. And I would just say to all the students, what I remember most about you, Ranya, is your enthusiasm for everything you did. I mean, whether we were, trying to put a seminar together or you're telling me about your biology classes, it's just always such a pleasure. And I think that's the key for kids. If you can just find a thing that you have that enthusiasm for and roll with it.
Yeah.
Yeah. Yeah.
I love it. Thank you so much, Kathleen.
Oh, you're welcome. It's great to see you.
Likewise.
Ashley says her microphone isn't working, but she has a question that she put in the chat.
Okay, I see this. When you were speaking about dueling vaping, I think one of the photos said something about it affecting your brain. Could you expand a little more on that and other side effects other than obvious answer the lungs? It's a great question. So the biggest impact that smoking is having on these kids is to the developing adolescent brain. Your second greatest period of brain growth occurs in this like 15, 16 through 21 age group. And so the effects of nicotine on your brain is actually not like adults. It makes you have more, you seek more rewarding, it has a rewarding effect on your brain. You seek other drugs like cocaine, meth, heroin. Kids are using those drugs more because they started smoking, and nicotine has that effect on their brain. Causes adults to kind of like, chill out because it's more of a depressant. In kids, it makes them kind of go a little bit more hyperactive. And so it just definitely can affect brain development. And I think that's the concern with the growth that's happening at that age as well. Side effects, there's just so many things in the vaping products. Like there's this vegetable glycerin and polyethylene glycol, which are safe for ingestion. So taking it orally by the FDA, they've said it's safe for that, but it's not known for inhalation. And people can, what are the effects of this thing? Well, people can change the ratio to, decrease the side effects of throat irritation to get more nicotine and a better high off it. People who start smoking or the vapes, or vaping, or like adolescents are like 30 times more likely to start smoking cigarettes and then go on to other drugs than people who are not smoking. I think there's a percentage is 30% compared to 8%. So 8% of people who have never smoked before, they won't necessarily, they are 8 times higher to go to smoking combustible cigarettes, but people who vape are 30 times more likely to go to combustible cigarettes. And so there's some stats about that are just kind of alarming. And I think, it took 20 some years for us to realize what the major impacts of smoking tobacco, like combustible cigarettes are. We're about 10 years into vaping. It's been around since about 2007. And in kids, it's been major since about 2011. So, are we really going to figure out what the health effects of these at the expense of children's health later on? It's these tobacco companies are trying to make a new, what is it? They're trying to get a new generation addicted to their product so they can, maintain their money, their source of inflow there. I hope that answers your questions. I can definitely speak to you more about this later if you have more questions.
Yeah, I just have a quick question. So I just got a job working at a child psych facility.
Oh,
And I was
wonderful.
wondering if you had any tips on kind of what would help me navigate that kind of realm.
I will tell you, when I did child psych at the Virginia Treatment Center for Children, that was legit like the hardest experience I had in med school. Seeing the children and really trying to manage their symptoms was difficult because the children just think differently. I think the most important thing is if you're working directly with these children, having them learn to trust you so that they can kind of, what's the word I'm looking for? They can trust you to divulge information to you that will help them and they'll feel comfortable talking to you, for example. I just, for some reason, remember, we weren't allowed to hug, even though you really wanted to, because some of these kids have gone through so much trauma, and toxic stress and adverse childhood experiences will dictate their later on. On stress. And that's why they have a lot of these mental health. Yes, there's a family like history. If a parent has like drug use in the house and as men, and can unfortunately, you know, it increases the risk of suicide or suicidal ideation and attempts, and it creates mental health disorders that gets them into the hospital. But just knowing that there's that, you know, there's always a reason for this, you know, whether it's in their history, in their past, in their household, just knowing that is just helps you kind of understand what they're going through. But Nadine Burke Harris, First Childhood Experiences, look up. She's actually the Surgeon General of California. She has an amazing TED Talk, and she spoke to a group of us at the American Academy of Pediatrics a few years ago. So she's amazing, and her TED Talk was inspiring. And good luck with that. Any other questions?
Yeah. When you said that you had to study a lot of different ways in med school for different subjects,
Yes.
could you tell me what that looked like?
So I was somebody who memorized a lot. Like, that was my thing. I could memorize whatever you wanted me to, no problem. But it's a lot of critical analysis, critical thinking. So I would do flashcards. I would write my notes up again and again, whether it's like written on a tab or on paper, or I put it up on that whiteboard wall. We had these things called Anki. I don't know if you all have heard of it, Anki flashcards, which is how we did. I tried to learn some different like drugs and things. Some people are visual learners, some people are not. I'm not. I have to read it over and over and over again. And I think repetition is key, and was the key to doing well, kind of making sure you understand the foundation and then building upon it. I would listen to my lectures after lecture. I listened to them again because they'd be recorded, and I would take notes and make sure those notes were pretty thorough. And that was kind of my biggest, that was what worked for me. Doesn't work for everybody. So some people have a better brain than me, and they're able to learn it a lot easier. But for me, repetition, using flashcards, using like writing it over and over again, re-listening to lectures is really what helped me. All right, Nadine Burke Harris, so you guys can look her up.
I was wondering if you mentioned like the flu shot and getting your vaccines.
Yes.
I was wondering if you've ever encountered misinformation among your patients, like when you're working with them in the doctor's office, and if so, how did you try and combat that misinformation in like a non-confrontational way?
Yeah, so that's the bread and butter of pediatrics right there, vaccines. So I am so lucky that I work in a practice that will not see your child if you don't decide to vaccinate them after 2 months, which is great because it just tells parents, this is why we think this is so important. Vaccinating is the most important thing that you could do for your child. Please do it. There's nothing bad in them. They've been studied like 1,000 times. There's like 1,000 research papers that said that vaccines don't cause autism and they're safe. With COVID now, it's opened up a whole new Pandora's box. People are refusing the flu shot because they think we're giving them the coronavirus shot or the vaccine, even though we don't even have a vaccine yet. People think we're inserting chips in them through the flu shot, like it's a thing. So I ask parents, what are your concerns? They let me know, and I address those concerns directly. And I don't do it in a confrontational way. That's why I ask them, I hear you, what you're saying. I want to know, what are you thinking? What are your thoughts? Why don't you want this vaccine? And what can I do to kind of help make you feel that, I think it's important. You can start getting the flu shot at 6 months old. And so I use my baby to help me a little bit because I got him his shot at about 8 months old. So I kind of use him to say, I did it for my child. So I feel comfortable enough and safe enough doing it for my child. So you should feel safe doing it for yours. And sometimes that really works. I had a family this week actually who's like, would you do it for your child? And I'm like, well, I already gave him a flu shot. So yes, I would. But I think it's always about asking them, what are your concerns? And then answering those concerns directly. But we have a lot of misinformation. And I actually just gave an interview to a group at University of South Carolina about misinformation related to vaccinations. These are some great questions, y'all.
So Ranya, what's next? Are you planning to stay there for a while? Is this going to be home?
This is, I think, going to be home. My husband's family lives up in North Charlotte, so being close to them has been really important. And I think my parents might move down from Richmond. So,
Oh, nice.
yeah. So I thought I would be back in Richmond after residency, but I think, meeting my husband and starting our family has kind of changed our priorities. Being close to his family has been really great because he has a lot of cousins, aunts, and uncles as well, extended family. And I just have my parents in Richmond. My sister just finished law school, we're married, and she's looking for a job, maybe internationally. So I think we'll be settling over here in this area for a little while. I like that I'm still in South Carolina because I know what resources are available for my patients, like developmentally, socially. I know what there is here. And so I like that I'm in South Carolina still rather than having to relearn a whole new system again in North Carolina if we have to move up there. So I prefer to stay down here. I would love to go back to Richmond, though. I still have my Richmond skyline behind me, hanging up in my house. You can see it. I don't know if you can see it, but I took that picture from the pedestrian bridge before I left Richmond after med school. So it stays with me.
What's the ethnic makeup of South Carolina?
Oh, well, I think it's pretty. I think it's just like African American. There's like half and half with Caucasian. There isn't a lot of diversity here beyond that. I mean, in residency in Charleston, like I saw no Arabs. Didn't see very many Indian people. A lot of African Americans and Caucasian people. But it's a poor state. It's a really poor state. A lot of rural areas. There were plants and mills that were here that have shut down. I'm reading Bakari Sellers' book right now. I don't know if you know Bakari Sellers, but he was from just south of Orangeburg in Columbia. And I just started reading his book, and he was talking about how like Coca-Cola had a bottling factory there, and there's another factory down there, and they closed when NAFTA started. People went overseas. Mm-hmm. So it's become a pretty poor country, pretty poor state. So
tell me then, two last quick things from me.
Yeah.
Why is it that Jamie Harrison has such a problem overcoming somebody like Lindsey Graham if there are that many blacks down there? That's number one.
Voting. They don't go to vote. They don't vote. That's the problem. That's why I stress to my patients the importance of voting. Mm-hmm. People are not registered to vote. I think you have to have an ID here to vote, so that also disproportionately affects lower socioeconomic classes. Not everybody has a driver's license or a DMV. We do have a lot of immigrants here, immigrant population, Mexican, South Latino population down here. So and they don't have IDs the majority of the time to be able to vote either. So it's tough. It's tough. But I really feel like in recent years, there has been a huge increase in the amount of people who are kind of going out to vote for Democrats here. I think there's a little bit more. And hopefully he'll defeat Lindsey Graham. You didn't hear that from me. Hopefully he did.
Yeah, it looks like a nail biter to me.
I know. I'm excited.
And Lindsey has been trying to get more money and using his
Lindsey Graham has an office in every city and town in South Carolina. Every single one. So he's pretty well established here.
Yeah, this country is, there's a lot of sadness for me looking at this country. And lastly, what do you remember most, about being in the Alexandrian Society, number one? And two, what advice would you give the present Alexandrians listening to you now?
What I remember most are the symposiums, putting those symposiums together, together, and having speakers come from all over. I think I still follow Laurent Dubois from Duke on Twitter.
Yes. Mm-hmm.
Yep, I follow him on Twitter. Like having these speakers come, and there was one speaker, I cannot remember his name. I'm like the worst. He signed a book. He even signed a book that I have, and I'm like having a brain fart right now. But being able to meet these academic scholars and to learn from them was just incredible. And then what advice would I have for y'all? Enjoy your time. Do what you enjoy doing. Keep an open mind and be well-rounded. I think those are the biggest things. Everything happens for a reason. And so just gonna do what makes you happy, and you will find your niche and where you're interested in.
Great.
Yeah.
Great, thank you.
Yeah.
Sai is coming on next week. So
Is he?
if you want us to send you the link, we'll do that.
Yes, please send it over.
Mhm.
Yes,
you-
I would love that. Oh, I have not talked to Sai in forever.
Yeah, he's coming on next week.
Awesome.
No,
Well, yeah, send me that
no,
link.
yes, next week, yes. Next week.
Same time, same place. I can send you the post.
Okay.
The link.
Thank you. Yeah, I still use my VCU email address, so
Oh, you do?
I do.
I saw the one you put in the chat, so I can also.
There's that one too. Yeah, that one too. Either one. Either one.
So anyway, just from my point, just a special thank you. It's so great to connect with you again. And those symposiums, we were the best. We were the very, Kathleen and I talk about those symposiums all the time. And they're a record. And that's why I said, you know, we need to have those things on a way people can still see the site and what we did, the record of the Alexandrian Society during those years. It was those,
Yeah.
meeting those scholars from, as a matter of fact, there's a scholar from Duke University. She's after your time, but her name is Travonia Glimpf. And today I got an email from, I think it's called the History Center, something or the other. They're well known, that center, and they advertise a lecture by her, a Zoom lecture.
Oh, wow. Okay.
And praise her to the sky, to the limit, right? Because she's from Duke University, and I remember writing to her to invite her to give a lecture. And those people at Duke know me, Lauren DeWanda, and she's working with those guys down there. So she accepted and came to VCU, and we did a lecture, took her out for dinner afterwards. It was fantastic. And now to see her name just today pop up, giving this big Zoom lecture and being praised so much. I said, these are people who came to us. So I emailed it to the faculty in the history department who teaches the Civil War, because her specialty is the Civil War. So she's giving this talk about Black women in the Civil War. Mighty interesting topic. And these are people who came to VCU at our invitation. I said, so I emailed it to the faculty in our department who teaches Civil War. And I said to her, Katie, you may have seen this, but just in case. Katie writes back to me within no time and says, Bernard, she has been my mentor in terms of my following her career. I have my students read her work. I had them listen to a lecture she did, but I didn't see this one. Thank you. So I'm going to send this one and make sure they tune in. And just goes to show you the level at which we work. Nobody else in the university worked the way we did.
Yeah, I know. It's a pity that the funding is just not there.
Yeah. Well, you have to fight for stuff, you know, and
I know.
that's what it calls for. As Obama said, nothing, even politicians, they won't move unless you drive them to move.
Yeah, it's true.
So thank you. Thanks a lot. It's great to see you.
Likewise. Thank you so much for having me. I appreciate that.
Yeah, thank you very much, Ranya. And do you mind if this lecture was recorded and could be posted on the history web? Okay, great, perfect.
Yeah.
Thank you very much.
Yeah, of course.